Luminary presents Therapy versus the World. I'm your host, Joe Nucci, and today I have the distinct honor and privilege of talking to Dr. Nancy McWilliams. Many of you may know Nancy through her books about psychoanalysis, about psychodynamic theory that are too numerous to name. She has been a real powerhouse in the education of many practitioners, many therapists, including the therapists that you see for treatment. We talk about dream analysis, about parenting, about mommy and daddy issues, about society and diagnostic language being used in culture and in the treatment room. I learned a lot from getting to interview her and getting to experience some of her years of wisdom, and I know that you will too. Before we begin this episode, I'd really appreciate it if you would like or subscribe wherever you're listening or watching this podcast. And with that, I can't wait to show you this conversation I have with Dr. Nancy McWilliams. Nancy, it is such an honor to have you on. I'm very, very excited to talk to you. Thank you.
You're welcome.
Yeah. Well, let's just dive right into it. What are mommy and daddy issues? So as someone that spends a lot of time combing through the internet and pop culture and how people talk about mental health, and someone who pays attention to how people in his life talk about mental health or psychology, and as a trained clinician, I've been thinking about this question more, and I've been thinking about it more because, well, everyone has attachment to their caregivers, and we know, not just from the more kind of psychoanalytic psychodynamic literature, that when you hit puberty, that same brain circuitry, right, kind of transfers from parents like onto peers and romantic interests. And I don't know, it's just, for me, it's everyone has it. Does that necessarily mean that like everyone has mommy or daddy issues, or like at what point does it actually become a clinical concern or a concern if you're dating or interested in someone romantically or sexually? And I think a lot of people think that this is this question has a simple answer, but I was curious to talk to you about it in terms of both how we think about it as clinicians, but also how people can think about it in terms of navigating their life with romantic interests, with people in their lives in whatever capacity it might be. How do you understand the question?
Well, it's interesting. I never use that term, mommy or daddy issues. It's an alien term to me. It suggests to me a kind of devaluation of our attachments to the people who nurtured us and brought us up, as if, you know, we should be sort of slightly contemptuous of the idea of being interested in how our parents influenced us. So it's not a language that I tend to speak. And I don't come at the question from that end of it. I come at the question from the end of it of somebody coming in and suffering in some way, and needing help with their suffering. And the first thing that I have to do as a clinician is try to understand what's the nature of their suffering, how do they experience their suffering, what caused their suffering, what in their history might have made them vulnerable to the kind of suffering that they have. And that usually leads back to their early attachments, not always in a powerful way. I mean, sometimes people are reacting to here and now stuff that would bother anybody. I mean, they develop an addiction. It may have nothing to do with their attachment history, but it may have to do with certain kinds of bad luck and their biological vulnerability to certain kinds of brain processes. And to deal with the addiction, you might not have to go a lot into what happened to them when they were kids, because it might not have a lot to do with that. So, you know, I come at it from the end of trying to figure out, in order to help people, I think you have to have some kind of a narrative about what makes sense of their suffering. It's hard not to get into parental issues.
Yeah. I mean, well, as you say that, it occurs to me, I guess I don't actually ever use or think about this terminology either, but it is one that I see often in culture. You know, on social media or on blogs, or even in kind of a casual conversation amongst friends, trying to understand someone's behavior. Maybe it's maybe some people get really emotional, or that something kind of bizarre or strange happened, and it's the label they slap on it is like, oh, well, like, you know, about their family mommy issues or daddy issues or whatever it might be. Can you say a little bit more about how I really like how you pointed to that there can be so many other things that contribute to, let's say, dysfunction in a relationship that actually don't have to do with childhood? Could you say maybe two more things about that just from your perspective? Because I think people who know you as, you know, someone that taught them about psychodynamic therapy. And we often think about the past in psychodynamic therapy. And so you approaching it in that balanced way, I think would be worth double clicking on.
Well, let me think of an example. If you're in an abusive relationship, it doesn't necessarily mean that you were probably in an abusive relationship as a kid. We know that if you abuse people in certain ways, it tends to elicit certain kinds of behavior if the person feels in a weak position, socioculturally or in terms of power dynamics. And it may be that you had a parent who was abusive to you, and that set up a prototype, and that's what you know, and you unconsciously are reenacting that. But it may be because you had the bad luck to run into somebody that was very compelling in certain ways that didn't involve their abuse, and then they began to abuse you, and a certain kind of vicious cycle gets started. I think there's almost nothing that doesn't have some connection to how you were brought up. But there are other things that affect people too, their physiology, their temperament, trauma.
How do you understand emotional abuse? How do you define it? I think when I track and attempt to measure how people talk about this term on social media, sometimes the term resonates with me as a clinician, and sometimes it seems to creep into this territory where it's the example they use. I start to think of myself, well, is that abuse or is it conflict? And or is it, or, you know, is there other stuff going on? So how do you understand it?
I think I'd have to say that abuse somehow inherently is a kind of treatment that lacks respect for the other as a subject. It relates to the other as an object, often an object that you're using to support your own self-esteem. So you criticize the other in certain kinds of damaging ways because it makes you feel superior. So I think, you know, there. It's a little bit like, I think it was Oliver Wendell Holmes who talked about pornography. You know, I can't define it, but I know it when I see it. I think viscerally, we understand an abusive situation. For example, we can viscerally feel when a group of kids shift from just fooling around and kind of ragging on each other to bullying. And you even see this in animals where they suddenly will change their play into dominant submission postures because somehow they've crossed a line. And it's hard to articulate that line. But abuse seems to me to be the use of the other person, you know, in ways that don't respect them.
I really like the emphasis on the word respect, because I think that oftentimes the conversation focuses on like power, like something like in coercive control. And there certainly are dynamics of power in emotional abuse or an abusive relationship, but there's also dynamics of power, I would argue, at least in any relationship, even in a healthy one. And so I think by adding that distinction of respect, it's not like the whole picture, but it's this other ingredient, as you say, where it's like you just kind of know. And I was thinking about this recently. I was reflecting on moments in my life I saw someone, you know, kind of interrupt their partner like needlessly and just like correct little things about what they're saying, never leave their partner alone. And maybe it's something that I notice more now just with my training, and that I couldn't have before. I just didn't have the life experience. It could just be getting older. But I remember there's this like icky feeling that comes up for me. It's almost like this like disgust response where I go, oh, I really don't like that. And it's, to your point, it can be very tricky because someone else could correct something their partner says or interrupt, and I wouldn't have that response. And so it is highly contextual, to your
Yes.
point.
Yes. And it's why therapists have to learn to trust their gut, not just their intellect, in order to understand the meaning of things.
Most definitely. Something I've struggled with, because, I'm still a much greener practitioner compared to some, although, I do have quite a few hours under my belt at this point, is something that I struggle with is in my life, not in therapy, but in my life, I will sometimes get these feelings. And at the beginning of my journey, I guess you could say, becoming a clinician, it was a lot of like learning how to turn the volume down on like the shrink brain, if you will. But the older I get and the more discernment I get, I'm starting to notice that I will get a feeling, and I will then sometimes say to myself, I'll say, well, you're not at work. Like no one, wants that armchair analysis. You don't want to do that armchair analysis right now. You're not at work. But I've noticed, it's been over the last year or two, that those initial feelings end up getting proven right. And it's like I talked myself out of my intuition.
Oh, that's
in
interesting.
some ways.
Yeah.
And I guess I just wanted to know what you think about that. Someone who has much more experience than me, both inside and outside of the session, because I think at the beginning it was kind of like turn off or suppress that mode of thinking because you're you don't know enough, you're misapplying it, or that's not what's needed right now. But as I get older, the experience seems to be, no, I'm pretty good at turning it off. And it's actually when it gets turned on, like the experience is like someone turns it on by something they say or something they do. I'm starting to be a little bit more like, oh, like maybe I listen, not rush to judgment, of course, but just remain curious. And I don't know if that's something you struggle with, but that's something that I've been thinking about for myself.
It's interesting. I've thought a lot about how therapists think or feel differently in their role than either the way they are out of their role or that other people often are. And I can't identify a time in my life when I wasn't really fascinated by other people and what made them tick. So I'm not sure. I make a very strict separation. I have to say that I do think one of the things people don't understand about being a therapist is how exhausting it is to take in a lot of negative feelings and try to process them without doing what's natural, which is, to fight back or feel dreadful. Or, there are ways in which we have to contain a lot and figure out where we could go from there. That requires a lot of mental and emotional energy. And I don't want to do that in my spare time. So I don't pay attention to certain things that set that off. So I think I understand what you're talking about there. I also know, though, that you get into the habit as a therapist of that kind of reflectiveness. And it can be burdensome to other people that's true. I mean, it's not like we're all running around trying to diagnose other people. We tend not to. We don't want to work in our spare time,
Right.
But they're not wrong that sometimes we react in a way that's not normal. There's a group in Germany that studied normal affect, and part of normal affect is to match people. So if people are pissed at you, you tend to look pissed at them back. But in psychotherapy, he did videos of people, and he found that in therapies that went well, whatever the therapist's theoretical orientation, what the camera showed was the patient would come in with a negative affect, and the therapist would show a different affect instead of matching. So like the patient would come in pissed off, and the therapist would show on their face curiosity about why you're so angry. And he called it abnormal affect. But I noticed when I was bringing up kids that my kids would sometimes be exasperated with me if I reacted that way. once my daughter told me she'd broken up with a boy that I hadn't really liked. And my immediate response was, oh, that must have been really hard for you to do. And she said, Mom, are you aware that normal mothers would say, good, get rid of the bastard? You know? So my
Yeah.
automatic empathic immersion in what she must be feeling was not welcome to her. In fact, I think my kids
Yeah.
sometimes felt kind of invaded by my empathy.
Yeah, it's a really lovely distinction. I need to look up this study later. I know that a reflection my friends and loved ones have given me is if I'm you know, in the checkout line at a party, wherever I am, and someone expresses their emotions in a very big way without even realizing it. I'm often unconscious of it, but I just kind of disarm. You know,
Yes.
I don't respond.
Yes.
I don't respond how they want to respond because I've had too much practice sitting in
Yes.
intense affect or being with people, and there's something that's good about that because I don't let them, you know, affect my space or like ruin my day or throw me off as much as maybe it would someone else. But then I think there's been this other side of it where sometimes someone is being difficult, and it's been a constant meditation for me. It's, well, just because I have the practice or skills to navigate this with you doesn't mean I have to. You know, maybe I actually want my relationships to be, you know, easier. And so in terms of new friends or going on dates or whatever, that's been something that's been very top of mind because you can be very, very like strong, right? That doesn't mean you have to carry a heavy backpack around all the time, is kind of how I think about it.
Yeah. That makes sense.
Yeah, I think it's also, you know, partially personality. I know that I've taken, you know, every personality test that I can find, and I know, you know, I scored very high on extroversion, and so I'm very, you know, like sensitive to positive emotion, and I know before my training I scored very low on trait neuroticism, but I actually think it was almost too low to be an effective therapist. And when I've taken the test again and looked at my results, I actually think I would probably still score low, but a little bit higher because I need to be somewhat sensitive, you know, to different negative emotion in order to, you know,
Yeah.
be with my patients in an effective way. And so that's been an interesting internal shift for me as someone who was always kind of like a golden retriever, if you will.
Yeah, I'm a bit like that too, and had to be sensitized
Yeah.
to, oh, you know, I, I was putting a kind of positive spin on this, but actually that was probably motivated by hostility, and I barely noticed it. Is that the kind of thing you're talking about? Where,
Yeah,
yeah.
absolutely, 100%. Where I think I mean, if you think of like just the 5-factor model kind of personality measures, it only really, for me at least, gets interesting when you are on the extreme end. So I think
Yeah.
when I first took the test, my trait neuroticism, I was like 5% or something. I mean, I was very, very low. And I think one of the things that I learned about myself was, oh, I think sometimes people actually are, you know, can be a little bit mean to me or show a red flag or like whatever it is that I wouldn't even notice because I just wasn't sensitive enough, and I'm just kind of, you know, going about my time. And
Yeah.
there is something protective about that in a way, but then there's also something not super great about that as well.
It's true. It's true. Paranoid people are sometimes way ahead of the rest of us because they pick up on all kinds of
Totally,
stuff.
absolutely. Well, this brings me. I did want to talk to you about personality, and something that I've been curious to ask you is the following. I was trained psychodynamically. I've, you know, read some of your books in school, and, you know, I've read the PDM and all this stuff, and so I appreciate the more kind of dimensional, kind of dynamic categorization of what we might call, you know, instead of narcissistic personality disorder, it's like trait narcissism, right? Or instead of, you know, this, it's trait this. And I think as a clinician, I have found that very helpful because when I'm trying to understand the person in front of me, I'm no longer seeing if they check all these boxes, but I can understand it's like, oh, they have a sprinkle of this, you know, or they have a lot of this, you know, and maybe it does fit a diagnostic criteria and maybe it doesn't. But something I've noticed as I've really gotten to know how the typical person talks about mental health and uses terminology is that that dimensional model seems to trip people up. So for an example, I see a lot on social media and these, you know, these videos, they get millions, sometimes hundreds of millions of views and engagement. And so it really impacts culture, I think, in a significant way. I'll look at their example of narcissism and I think, well, maybe, or is that person just selfish? And aren't we all a little selfish? Or I think maybe, but a grandiose coping style is also normative. I'm not totally sure that and it's difficult to communicate some of these ideas in short form content. And so it's not necessarily the content creator's fault. It's almost like a natural consequence of the medium. It's not the book. It's a 60-second video. And I was wondering how you think about that in both. I'm less interested in your perspective on the clinical conversation piece, because I feel like you and I are probably more aligned on that, but more in terms of when it comes to the layman, the typical person, the average person using terms, like narcissism or trauma. Like at what point does how do you think about the dimensional versus the more kind of operational definition you might find in the DSM? Because I think a lot of people, what I've heard, find it confusing to know where to draw a line or how to contextualize these different things.
Well, I think the DSM has done us something of a disservice in the area of personality, because they talk only about personality disorders, meaning personality structure that's gotten to some kind of an extreme. And everybody has personality. Everybody's got narcissism. Everybody's got masochism. Everybody's got a schizoid streak. I mean, everybody can find in themselves all of the elements that, if they are extreme or very primitive, would go into a personality disorder. So I've been troubled by this for a long time. There's a difference between talking about your normal narcissism and calling somebody a narcissist, or saying, or that applies beyond personality too. I find it disturbing when people refer to someone who's had a psychotic experience as a schizophrenic, because it's completely reductive to a certain kind of objectification of the person's experience. If you're going to help people, you have to have some understanding of what their personality tendencies are, and the language in which therapists have talked about different kinds of personality styles has lent itself toward more and more pathologization over time. That's true not just in personality, but you see it all through all kinds of use of psychological terminology. We didn't want to call people idiots and morons anymore, so we started calling them people who were retarded, meaning slowed down, which was thought to be a completely pejorative way of talking about them. But over time, the term retarded took on a terribly negative. People started talking about retards and objectifying it, and then you begin talking about mental deficiency, and then that became mental challenges. And you see this effort to keep working against our tendency to objectify and pathologize and blame instead of really understanding. So a lot of my career has been devoted to trying to talk about how much of this versus do you have it or not?
Yeah. I think the distinction between blame and understanding is very, very important, because I think for me, when I see content or conversations where I feel like the terminology is being irresponsibly used, it's from a place of like judgment, blame, my ex was a narcissist,
right,
and so I didn't do anything wrong, they're the worst, I'm going to trash the reputation and move on to the next person, right. Which I always chuckle when I hear stories like that, because I'm like, well, that's actually the behavior of someone with narcissistic tendencies, ironically, right? And so, but the And I love how you point to the it's not exactly a euphemism treadmill, but the way it's kind of like evolved over time. And I really love your interpretation of it, it's, it's we're fighting against this tendency to just kind of label and blame and judge,
Yeah.
and more to more deeply understand. The argument reminds me of, what Alan Francis talks about in terms of like saving normal and let's
Yeah.
not pathologize everyday life. Can you
Yeah.
say a few more things about your argument, but with his context in mind? Do
Oh,
you share his
yeah. I
concerns?
do share
Yeah.
his concern. For
Yeah.
example, we don't talk about being sad anymore. People don't say
Yeah.
they're sad.
Mm,
They talk about being
yeah.
depressed.
Right.
People don't say, I find myself scared. They say, I'm anxious. Now, anxiety used
Yeah.
to be a concept that came out of
Mm,
psychiatry that meant that you were feeling fear in the absence of an obvious stimulus to the fear. It was internal, and
mm,
we distinguished between anxiety and fear. Now
yeah.
everything is a mental health condition. We really have
Yeah.
lost the idea of normal grief, normal sadness, normal mourning, and everything is
Yeah.
depression and should be medicated or treated with some kind of
Mm,
focused
yeah.
effort to change your feelings. Whereas I think the good life includes a certain kind of acceptance of normal suffering
Yeah.
and sadness.
Mm. What's your perspective on a lot of the positive psychology stuff? I know that for me, one of their pillars is purpose.
Hmm.
And I think for me, absolutely. And when I think about my meaning and purpose in my own experience, there's been a lot of unpleasant emotion, a lot
Hmm.
of suffering. It actually
Hmm.
hasn't all felt positive. And
Hmm.
so for me, sometimes I think that, and I'm not an expert in that field, but sometimes I think that the term of it, positive psychology, sometimes I think maybe it should be a different name, because my experience as both a person and then also as a practitioner is, people don't want to just feel deliriously happy all the time. That's not typically satisfying to most people. And so
Yeah, I
it's
think
just made me
the
wonder.
positive psychology movement has included a lot of good stuff. As a general orientation, I find myself faulting it the same way you do. There's too much of an emphasis on happiness and not enough emphasis on a really in depth experience of all kinds of feelings. I think part of feeling a vitality in life is being able to feel a depth of anger, envy, sadness, um, shame, and really own those parts of the self. Uh,
Mm,
suffering
yeah.
suffering isn't always something that you simply try to get strategies to avoid. Sometimes you have to
Mm,
go through it and come out the other side of it. So I have
yeah.
some critiques of that nature, but like any other
Yeah.
movement, it
Yeah.
one of the reasons that I think Martin Seligman and others tried to frame it that way was that they were responding to the way that psychiatric labels had been used to pathologize so much.
Mm, yeah. Yeah. Earlier, you brought up this idea of kind of, resensitizing yourself to negative emotion, in
Mhm.
terms of, becoming a better clinician. And you also used the term reenactment earlier. So one of my questions for you is a very kind of a typical curiosity in therapy. So let's say someone comes to see me, and let's say it's she's a young woman in her 20s. She's dating, and she finds herself. She keeps on winding up, beginning relationships with men who turn out to be aggressive.
Mhm.
And you find out when you talk to her, about her, let's just say father, just to make it, simple. Her father, displayed some aggressive tendencies. So this is oversimplified, of course. There's like the kind of dynamic approach where it's like, is there reenactment? Is there like an unconscious attraction? It has been my experience, and I was trained dynamically. And so it was very surprising to me. I have seemed to have more success in helping people with problems like this, actually taking the more kind of cognitive behavioral, like thinking of in terms of like, well, let's actually resensitize you to these little signs of aggression that are surely there, and people often seem to find it quite comforting to know that it's like, oh, there isn't this like deep part of me that I don't know how to access, like in my unconscious, that cause me to pull these, like, oh, these are steps that I can take, versus, and if that doesn't work, I've seen a lot of success in terms of like, well, let's actually integrate the part of you that likes aggression. What do you mean? You mean you like strength? You mean you like, healthy dominance, or whatever it might be? And so I kind of give you those three buckets because I sometimes struggle with which, as an integrative practitioner, which orientation to use on different people. And I just wanted to know what you thought if there were different pros and cons to approaching it differently when you're working with someone one-on-one.
I always find it really hard to generalize about how I work or how I work with people who have trouble in relationships because I get so completely immersed in the individuality of the person. With one person who has made several bad choices, it may turn out to be something that's fairly superficial that she could do differently. With others, they're like homing pigeons to a particular kind of replication of an early relationship that is going to take some time and some unpacking to do. I think it's hard to generalize across these experiences. I also, though I came along too late to be fully trained in CBT. So although I pick up things as they go along, I can't mouth off about using CBT because I'm not well trained in it. But I do find myself doing things like coaching or, for example, we've been talking a little bit about narcissism with, let's use the heterosexual woman finding herself repeatedly involved with men that turn out to be trouble, maybe aggressive, maybe narcissistic from her perspective and so forth. I have had some luck in saying, it sounds like if you pay attention early in the relationship to whether he can apologize when he hurts your feelings, you might have a way of noticing that he might be trouble. And that's sometimes very useful to people. They haven't thought about that. I mean, there's a whole psychoanalytic theory behind that people with pathological levels of narcissism are trying to support a grandiose sense of perfection. So they can't acknowledge when they make a mistake because that would mean, they lose their whole self-esteem because they have to be perfect. They can't easily acknowledge gratitude either because that would mean they needed something. So you can help people notice those kinds of things. And with some people, that makes a huge difference. I had a patient who used to say to me, I realized my chooser was broken and I just had to repair my chooser. And it was rather small things that he had to repair in it. Yeah. And he ended up with a really lovely partner.
Yeah. Yeah, I love the metaphor of like, you just needed to like, swap out a couple wires and you were able to kind of better discern. Yeah, absolutely.
The in-depth analytic stuff is very valuable when that stuff doesn't work. But often it does work.
Fair enough. Do you think that, I'm curious, as someone who's more, kind of in the psychodynamic world, from what you do in your perspective, one of my suspicions about the cognitive behavioral literature versus the psychodynamic literature is it seems to me that the more CBT stuff is just easier to measure from a research perspective, just given like what it is, And so do you agree that that has just been one of the challenges? And B, what is the state of psychodynamic literature today? Has there been anything fun or interesting coming out recently?
Oh, yeah. Of course, I'm always interested in the psychoanalytic literature. I've been fascinated by it since I was 18 years old. But I think certainly what people have done with attachment research, with parent-infant research, I'm thinking of Beatrice Beebe's work and other Miriam and Howard Steele, other people who've studied infant-mother interaction, Ed Tronick's seminal work. That's been an area of great interest. I'm also very interested in the work of Jaak Panksepp and Mark Solms and the other people who have been trying to explore what's the neurology of all this. Well, this they call it neuropsychoanalysis. So that's very interesting to
Yes.
me. And affect theories,
Yes.
like Rainer Krause's work in Germany that I was talking about, are kind of exciting.
Okay.
I like the integration
Without
movement too. I mean, I think that's a very,
yeah.
exciting development. I like the work that John Norcross has done for years, and Paul Wachtel, and I'm very grateful to certain researchers who have stuck with trying to understand things, not just based on what techniques will correlate very quickly with symptom reduction, but what will help people with larger issues like their sense of self, their sense of self-continuity, their sense of agency, their sense of safety, their capacity to regulate affects, their capacity to feel vitality, to accept what can't be changed. All of those things are more important than temporary symptom reduction to most people.
Yeah. When it comes to some of the exciting researchers and breakthroughs that you've named, I'd love to know something that's been confirmed that's delighted you, and maybe a surprise that you didn't see coming.
Let's see. What has been confirmed that's delighted me? I suppose the right brain to right brain communication that people like Alan Shore have documented. I mean, everybody always knew there was such a thing as intuition, and that there were things that we got that weren't going through what we now think of as the left brain. So that kind of delighted me. Things that surprised me, I was surprised learning originally from Mark Solms that many memories that the psychoanalytic community had thought of as repressed aren't repressed and can't ever be accessed because they weren't laid down to begin with, because under some kinds of trauma, the hippocampus is flooded with glucocorticoids and it shuts down. So it doesn't lay down episodic memory, declarative memory, the sense of I was there and this happened to me. What it does lay down is body memory and affective memory. So with our traumatized patients, they often have in their bodies and in their emotional experience some evidence of what happened to them, but they're not ever going to remember exactly what it was. Sometimes they do. So, I mean, there is such a thing as repressing,
Yeah.
but you can't assume that you're going to find memories that you wish people had
Yeah.
to help you know what
It's
happened to them.
I've had some experiences where people have come to see me where they, with another practitioner, have kind of uncovered a repressed memory. And it's interesting that you say that, because it seems that what helps them best is not, further analysis of it. What helps them best often is kind of, like more focusing on, like you talked about, the body memory, like a lot of the somatic techniques that I picked up seem to provide a lot of relief. And it's always kind of this walking this line of, because you don't, you want to like allow for them to kind of like, verbally process and feel seen and feel safe, et cetera. And also it's kind of like, and at least my experience has been, it's like, okay, and this now, and whether it's repressed or implicit or even like a made up memory, it almost doesn't matter because it feels real. And so it's like, okay, now can we release it? Can we move through it? Or can we lower whatever like the symptomology is so you can feel more functional?
Yeah. And to give up, they have to give up the fantasy that they could remember everything and know exactly then what happened to them. Because they probably won't, and they have to go on living anyway.
Yeah, absolutely. Absolutely. Changing topics a little bit here. What is your experience and opinion on dream analysis and working with dreams clinically? So I guess just to simplify it down, there's kind of two scenarios I'm thinking of. One is, working with someone and picking up like themes of their dreams in order to kind of conduct therapy, or two, someone who actually comes to therapy because of a recurring dream or recurring distressing dreams, because they may be slightly different cases. So I just wanted to kind of give you two more grounded examples.
I haven't ever treated somebody who came explicitly because of a recurrent disturbing dream, although sometimes I've
Okay.
found out as I'm working with somebody that they have a very repetitive, disturbing dream. But I find, again, there's a lot of individual differences in how much patients want to work on their dreams, want to try to understand their dreams. Um, in the case of the dream sort of constantly having the same thing, I think that's often clinically useful, even at once a week treatment. At more frequent psychoanalytic treatment, I love to work with dreams if the patient does. In my own analysis, I analyze dreams a lot. I did it via the old-fashioned Freudian way of associating to each element of the dream and then realizing there was a theme under all this. And I will still do that with my dreams now.
Yeah.
Especially if I'm under some kind of stress or I have a reaction that I don't understand, I'll wait and see what I dream and then I'll associate to it. And usually I can figure out
Yeah.
what might have been triggered. I just think the
Sure.
unconscious is extraordinary, and dreams are an extraordinarily condensed expression of major themes for people.
And when you have uncovered a pattern, let's say in a dream, what are some of the ways you then use that either for yourself or with the patient? Because I found it's not always clear, because sometimes
Yeah.
there's the becoming conscious of the pattern. Sometimes there's a lot of affect. I mean, to your point earlier, sometimes I feel the pull to just be intuitive with it, but it's not necessarily something that they covered in depth in school, which is why I'm curious to ask you about it.
Well, again, it depends on the patient, but first you have to be aware, oh, this is the same theme, isn't it? And then get curious about it. And as the theme comes up in the relationship, which it tends to do, the patient will tend to name it in the relationship. Let's say it's a person. I'm thinking of a patient who had repetitive dreams of not fitting, not being, of trying to, of being in danger, and she had to get through a tunnel and she couldn't quite fit, or through a window and she couldn't quite fit, or there wasn't a door that was going to open. And it was stunning how one after another dream had that idea. And then things started coming up in her relationship with me, where she started believing that she didn't fit with me. She wouldn't have belonged to my peer group. I must be thinking she's an outsider. And that led to a lot of stuff about her mother having treated her as alien. And there's a lot of evidence that her mother didn't want to get pregnant and didn't want her to be born and so forth. What's interesting is that over time in a good therapy, the dreams shift. Like I had a patient who had a recurrent dream about these frightening old Victorian houses with the cobwebs and the spiders and, like psycho. And over time, these houses began to get plants in them. There began to be light in them. They began to be modern houses. So she was still dreaming about houses, but they slowly shifted from terrifying places of doom to interesting places of safety. So I've seen that with a number of patients I've treated long term. Their dreams, and the patient I just mentioned who had the dream of trying to get out and not being able to fit, she just recently said to me, I haven't had one of those dreams for about 10 years. So she was talking about how much she felt like she belonged to her correct community, and she had
Yeah.
that as a kind of
Oh,
just spontaneous realization.
yeah. It's beautiful. Yeah, it's been top of mind. It's come up with some just some of my cases, but also I've entered this phase of my life where I've started to almost every night just remember pretty vividly what I dream about. And it's not that they're always like, stressful or worthy of,
Mm-hmm.
it's kind of some sort of analysis, but in my own personal therapy, my therapist has been having an absolute field day. I don't know where the shift was, or like if I started taking like a new supplement that allowed me to remember, or like what exactly happened. But it was weird because it was just only over the last year or two. I was
Uh,
showing up every week, and I was like, here's what I dreamed about,
uh-huh.
and seeing some of those themes. It's just it's nothing. It's not like any other sort of therapy I've had before, and it's just been kind of a fascinating exploration, I guess you could say.
Yeah, yeah. I really love
Yeah.
dreams. I mean, I think uh, Freud always used to say that that was his biggest discovery, was that there was meaning in dreams and what it might be. Not that I agree with everything
Yeah.
Freud said about dreams, I don't, but the idea
Fair
that they're
enough.
meaningful, I
Yeah.
do.
Yeah, absolutely, absolutely, and sometimes the meaning I'll sometimes even joke with my patients or loved ones if it comes up. I go, it doesn't take a therapist to know what that means. It'll be someone who became a widow, and they have this dream that their partner is living down the street with like the new family and won't talk to them, and it's just kind of
Hmm.
like it's like okay, well, like you're like of course this is an anxiety you have, and something like deep in your psyche and your nervous system. Why wouldn't it be?
Well, that goes to
So
the question of, for
yeah,
all our book learning, I think
yeah,
ordinary people and ordinary wisdom cultures have always had language for the kinds of things that psychotherapists immerse ourselves in. I'm just back
yeah.
from a trip to Greece, and I went to Delphi, and there are
Mm,
147 sayings that the Delphic Oracle is known for. Things like know thyself and nothing in
mm,
excess. And they are
mm,
pretty consistent with what any good psychotherapist
yeah,
would say is a fairly good
yeah.
recipe for the good life.
Oh, that's absolutely fascinating. What are your thoughts on the I don't know if a movement is quite the right word, but I've sensed over the last so many years that there seems to be much more openness around kind of integrating, ancient wisdom, Eastern wisdom, or from just like different spiritual traditions, et cetera. I mean, even something like meditation, mindfulness is such a buzzword today, but people forget that, even 20 years ago, it was a little bit woo woo,
Yeah, right,
and
right.
so, and now it's just like an evidence-based practice. I
Yeah.
personally think it's exciting, and obviously time will tell what is more useful and what is less useful. But
And for whom?
I'm personally a fan.
Hmm.
Totally.
Yeah.
Yeah. Yeah. Absolutely. As we wrap up here, I'd like to ask you a final question, specifically from the perspective of any parents who are listening. It seems to me that because I don't work with children and adolescents, but I do work with a lot of parents, and because I treat adults, and it seems to me that sometimes one of the best pieces of advice I can give them is I say you need to stop getting all of your advice from social media because and it's not even that the videos don't have good things to say. You
Hmm.
know what I mean? Like oftentimes it's like there's these, experts and they're psychologists or a pediatrician or whoever they are. And they often have really excellent things to say. I think the thing I remind my parents is that you are already like fielding so much just day by day, that you don't need to think of these like 15 other hypotheticals. And I'm just kind of I'm wondering from your perspective, what is someone who often does a lot of that more kind of like analytical dynamic work and talks to people about their childhoods and about their caregivers, what might you say to, I mean, I was going to say let's focus on parents, but maybe just anyone because we all have parents, and lots of people have kids. Do you have any just wisdom as we wrap up here? Because I think that while it's awesome how much destigmatization we've seen over the last 5 years, I've kind of simultaneously also seen this like rise in like anxiety about like, needing to kind of craft like the perfect childhood. And I'm
Yeah.
reminded of, the good mother always fails, and stuff like that. And to your point, like it's okay to feel sad sometimes. It's okay to feel afraid. It's okay to feel all these human emotions. Everyone has a little narcissism, everyone has a little masochism, et cetera. And so I'm just wondering if you have any reflections on that in terms of society's current anxious state of around parenting.
I feel a great compassion for parents. I am a parent. I'm a grandparent. I watch my kids being the best parents they could be. Everybody tries to do their best, other than a few things that you should not do. Like you should not inflict a major separation on your kids under the age of 5 if it's possible not to. You shouldn't send them off to live with grandma for 2 years and think that they're going to be fine about that when they're 2 years old and they come back at 4. You want people to understand that kids need continuity, and certainly you don't sexualize with your kids. So there are some things you shouldn't do, but in general, parents have pretty good instincts, and the parental hormones al- allow us to attach and love our kids, and also let them separate eventually. Uh, in psychotherapy, even people who start off really wanting to blame their parents, if the therapy goes well, they end up appreciating them and forgiving them for whatever mistakes they make.
Yeah, absolutely. Why 5?
Uh, because after the age of 5, better the age of 7, 8, or 9, uh, kids can keep an internalization of a loved object. And if they lose a love object, they can understand that they're not necessarily being rejected. A 2-year-old, if you, for example, if you get sick and you go to the hospital and the kid suddenly loses you for 3 weeks and nobody explains to the kids what's happening and nobody shows them pictures of you or has phone calls with you, the only way they can interpret that is, I wasn't good enough for you to keep. I can't trust anybody. You betrayed my attachment to you. So, it gets easier as they get older. But I think I'm thinking about that because there are some cultures where the babies used to be handed to the grandparents pretty early, which worked fine when the grandparents lived in the same house as the parents. But now in those cultures, they've urbanized, and the kids are being sent away at 6 months, a year and a half, 2 years, and then brought back to the parents at 4, 5, 6, 7, and they have terrible attachment disorders because what used to work when you were living right next to your extended family doesn't work if the kid then loses the primary object. So that's just something other things parents can do is try to conquer a substance use disorder, try not to abuse one another in front of the kids. We know that witnessing of violence is worse than being the object of violence if you're a kid. It's more damaging.
Oh,
So,
interesting.
there are things that you can try to do right, but otherwise, you do your best. Your kids will love you. They'll still have to separate from you. They'll eventually forgive you for whatever you did wrong. You'll end up thinking that you did a lot of stuff wrong, and then with hindsight, we can all do that. But in general, you should enjoy your kids and enjoy parenthood and not make it such a project that you can't just take delight in young kids. You have to get enough
Absolutely.
support to do that, of course.
Yeah. absolutely. Something I say to the individuals I treat who are parents is I have them reflect on, their own childhoods, and I ask them, I go, do your parents, can you give your parents everything, or do you give your parents all the credit for who you are and where you are right now in life? And they almost universally say no.
Oh, of
I
course not.
don't. And then I
Yeah.
say, and then I say, see, I go, take a little pressure off of yourself.
That's very nice.
you know,
That's
and
a
so
gift.
that reframe always seems to land. Well, as much as I want to talk to you for a whole nother hour, we got to wrap up. Is there any other kind of parting words of wisdoms or thoughts or reflections, or even any questions for me that you have based on today's conversation you'd like to share with anyone listening or watching?
So I think this is a very, very hard time because of the speed of change, because of the nature of the internet and the exposure that brings. It's a very hard time to feel like you can stay steady, keep your self-esteem, do your best. So we're all up
Yeah,
against some sociocultural forces
yeah.
and realistic fears about the environment,
Hmm.
about what's happening politically. Mm.
Mm,
We do our best.
yeah, absolutely. It's I didn't before kind of being a content creator and this aspect of my career, I didn't track the internet as closely as I do now, because now I do for, there's like practical work reasons too. And it's I am thankful for my training and my previous kind of, experience in my own therapy for that, because it is a lot, and it's very nice to have tools and just certain aspects of awareness, even if the tool is, it's okay to turn it off today,
Yeah,
you know,
yeah,
and go think about something. In fact, it's necessary to do
yeah,
that from time to time. All
yeah.
right. Well, thank you again so much. Again, I'm talking to Dr. Nancy McWilliams. You can look her up on her website, read any of her books. And for those of you who are still watching, if you are enjoying this episode, enjoying this podcast, please remember that Luminaries Therapy versus the World is also early and ad free if you go check out Luminaries' website. Thank you. And thank you for coming on.
My pleasure.